hierarchies, levels of analysis, a lot of rule-governed behavior. It's very complex settings, right? So how do we get in there and how do we analyze and assess what's going on when we have, let's say, performance deficits on the one hand, which is frankly what we're kind of usually dealing with. And then also take that same assessment and figure out like, well, the desired performances we want to see, why aren't we seeing those? And what can the assessment tell us about how to proceed with intervention? So hopefully at this point, you know that assessment is super important, right? Because without assessment, you don't really know why you're doing what you're doing, right? So we're going to get into the NIC analysis here, and I've got some slides here, and I've got some examples from your textbook, but I'm going to kind of walk you through it, and I really want to give you a breakdown here, and this is going to be super important for the assignment you're going to do this week, where you are generating your own NIC analysis, right? All right, so with that in mind, let's jump into what we've got here. There we go. All right, so the NIC analysis. All right, so the first thing I'm going to do is just like open up with the stuff that we all know at this point, right? Skinner's classic 3-term contingency, of course, that was expanded into the 4-term contingency. Motivating operations, obviously super important, right? And so you kind of see it right there. And like, this is nothing new. But what I want to do is just kind of take a moment to sort of talk about this. And sort of how we're going to sort of riff off of this and really elaborate off of this is kind of the key here for the NIC analysis, right? So you have your ABC, right? Antecedent, behavior, consequence, right? Now the idea here, of course, and just, to sort of, refresh everybody on the notation here, right? Antecedent sets the occasion for an operant response, but it doesn't cause it per se. Right. The idea of causality in the 3-term or in this, in 4-term contingency is that the consequence that the behavior produces is what actually is the sort of quote unquote causal relationship there. But of course, antecedents are important. And I'm not going to sort of, rehash all this for you guys, but that's why we have the dot here. The antecedent sets the occasion for the behavior, is the behavior that produces the consequence. And of course, antecedents that are in, sort of wrapped up in the context of the occurrence of a behavior that produces a consequence, those antecedents gain stimulus control over setting the occasion for those operant responses on future occasions. It's all very important, obviously. And then, of course, we can sort of go beyond that and say, like, well, what kind of motivating operations are sort of operating in the moment that might motivate various behaviors. Contextual factors here, motivating operations that might motivate certain behaviors, which, of course, might still have antecedents linked to them. But anyways, this is fantastic stuff. This is sort of the key. This is, this is the unit of analysis for operant behavior. This is what Skinner gave us, among many things, but this is arguably the key here. And this is all well and good. So why am I telling you about this? Well, what I want to do is kind of take this and just broaden the way in which we approach this, the way we think about this. So our focus usually is on like, what is the behavior, right? What's the behavior? Is it a desirable behavior that I need to increase? Or is it an undesirable behavior that I need to decrease, right? And so oftentimes we look to, okay, what's the consequence? What's maintaining that? If it's an undesirable behavior, what's maintaining that? How do we break that contingent relationship? If it's a desirable behavior that's not happening frequently enough, what kind of consequences can I put in place to increase that, right? And then, of course, antecedent factors, obviously, super important there. But I feel like we oftentimes get sort of stuck in this very linear thinking of, here's the B that I'm focused on, what's the C, and what's the A? And that gives you, if you're not taught to sort of broaden your way of thinking about that, it becomes this very linear, like, there's this one B, there's this one C, and then there's this one A. And then, of course, you could say maybe there's also this one particular MO that seems to, and it just becomes this like 1-1-1-1 sort of linear way of thinking about it. And the fact of the matter is, that especially when we're talking about human beings, especially when we're talking about, let's say, verbally sophisticated human beings working in a very sophisticated organizational setting, it is just simply not that linear, not that simple. This is, frankly, kind of a simplified analysis. And, that's not to throw any shade at Skinner. But what we're going to do now is kind of just walk through, like, well, how do we take that fantastic unit of analysis, basis of understanding, and try to broaden it out to sort of better just capture all of the different factors that might be influencing the behavior of employees in a very complex setting like an organization. All right, well, that brings us to the NIC analysis. So what I've done here, so of course, you've had this in your textbook. This is taken directly from your Daniels and Bailey textbook, chapter 10 here, right, NIC analysis. So here's what I kind of want to walk you through. And you'll notice the behavior that they begin with is smoking, right? And like some of you have smoked, some of you might still smoke, some of you have never smoked, but we all sort of, have a sort of basic understanding of this behavior and perhaps some of the antecedents and consequences that maintain it. So what they've done here is they've listed out a number of antecedents. Now, to be clear, you can see these in bullet points here. And when you read these, you go like, oh yeah, I can see that. That makes sense, right? Someone offers you a cigarette. Sure, right? If you're a smoker, you're like, oh, hell yeah, let's go. Oftentimes having a smoke after a meal. Or if you're having a drink, have a smoke with your drink. Seeing an ad might serve as an antecedent, right? Taking a break. What do you mean by taking a break? Well, taking a break from work, right? So, okay. You take a smoke break from work. Not only are you getting a cigarette, but there's also certain things associated with taking a break from work. Seeing someone else smoke. How long has it been since the last time you had a smoke? Do you have any kind of physiological habits and different things? That's kind of physiological things here in the bottom. All right. So these are all potential antecedents. And you know what? There's probably a lot more that we could list. This is a good list. And look at how many there are, right? There's probably like 9 of them there. That's a lot. There's probably a lot more we could add, all for the behavior of smoking a cigarette. Now let's have a look at the consequences. Now it's important, I want to point this out to you. If you're reading your textbook carefully, you would have seen this, but it's important to note that we're not linking, this first bullet point of antecedent does not correspond to the first bullet point of consequences, right? These are not linked in a linear, like A, B, C kind of way. And that, if nothing else, is the one of the most important points I want you to take away from this, okay? So don't think that the antecedent here corresponds to this consequence here, and that this antecedent here corresponds to this consequence here, right? And you can sort of see that's probably obvious, right? Like someone offers you a cigarette, that's obviously probably a powerful antecedent for you having a cigarette, but does that like directly relate to cancer? Not necessarily. Or like after you have a meal, if you're someone who likes to have smoke after finishing a meal, that doesn't like directly relate in this like linear ABC way to death, right? But when you look at this list of consequences, I mean, you can see that these are all potential consequences of smoking, especially smoking for a prolonged, period of time. So, right, cancer, death, emphysema, heart disease, yellow teeth. We all know those, and those are things we hear all the time. Those are things and reasons they say, hey, don't smoke. Smoking's bad for your health. It can lead to this, and this, right? So, like, none of this shit comes as a surprise. But also, let's have a look at some of these other potential consequences. Like, is it relaxing for you? Well, some smokers might tell you that, yeah, it's actually really relaxing. They might tell you it tastes good. Now, if you've never smoked a cigarette, or you don't smoke, but you've maybe had like a drag once or twice here, taste good probably does not make sense to you as a consequence for smoking a cigarette. But we're not talking about you here, right? We're talking about employee behavior, right? And it might be the case. Think about it. As a future BCBA, you might have some RBTs who smoke cigarettes. You might have some aspiring BCBAs who you're supervising who smoke cigarettes. Hey, that's their choice. That's fine. Doesn't impact their employment, or performance at work in any way. But again, we're just trying to understand like what are the various antecedents and consequences that maintain any bit of behavior. Smoking is just one example, but of course, ultimately we want to apply this to, hey, what are our RBTs doing? What are our aspiring BCBAs doing? So the point I'm making there is taste good. Like that might not make sense to you, but it might make sense to some of your RBTs, some of your aspiring BCBAs. Standing out in the cold, right? That is a potential consequence. Obviously, that sounds like an aversive one, along with some of these others like cancer and death and all that. Breaks from work and satisfying. So we have a whole list of consequences here. There's about, 10 of them there. And frankly, we could probably even add more to this list. So the point I want to make here is just for the simple behavior, seemingly simple, of smoking a cigarette while at work, there are a whole lot of different antecedents that might occasion that behavior. And there are a whole lot of consequences associated with that behavior. And they're not all good, obviously, right? Some of these are very bad. Some of these are good. And there's probably even more that we could add on here. So what is the point of this? Where are we going with this? Well, as you know from reading the content in your chapter in the textbook here, we can characterize all of these different consequences. And when we do the picnic analysis, we're talking about consequences, okay? We're specifically talking about that causal relationship from the behavior to the consequence. Yes, antecedents are important. But again, we're not lining up antecedent to consequence, right? These are not listed in a linear way like that. And when we do the picnic analysis, which of course is positive or negative, immediate or future, certain or uncertain, we're talking about the consequences. Because again, consequences are the most powerful sort of factor in terms of maintaining behavior or not. Okay, so, well, it's pretty obvious, I think, positive, negative. And of course, to be clear, we're talking, when we talk about the picnic analysis here, we're talking positive, negative in terms of like appetitive and aversive, right? We're not using, and I know that could be potentially confusing. We're not talking about positive, like positive reinforcement or positive punishment, adding a stimulus. And we're not talking about negative, meaning removing a stimulus. We're using positive and negative in the more like colloquial, everyday, like, is it good for you? Do you like it? Or do you not like it? Right? So I want to be clear on that because I've seen students kind of mix that up, and that is not the appropriate way to understand the picnic analysis. So cancer is negative, right? For sure. Okay. So we're not talking about adding or subtracting something. We're talking about like, do you like it or do you not like it? Death. Don't like it. It's negative. Emphysema, negative. Heart disease, negative. Yellow teeth, negative. Relaxing. That is positive, right? That's kind of a basic physiological sort of response to nicotine and having a smoke, right? So relaxing, that's positive, right? Tastes good, that would be positive. Standing in the cold, right? Like if you live somewhere in the cold and you have to go outside and stand in the cold to have a smoke, like that's negative, that's aversive, right? It's unpleasant. Breaks from work. I mean, it's positive, right? Getting a little break from work, it's positive. Satisfying, right? If you find it satisfying, positive. So that's how we're using positive, negative. And I want you to be very clear on that, right? And I know that differs a little bit from how you've talked about positive reinforcement, negative reinforcement. Again, this here is meant to be useful for people who maybe don't have a background in behavior analysis, right? So you need to be able to kind of shift here, right? Shift your use of technical terminology to more colloquial terminology. All right, immediate and future. This is something where I see students get hung up on this, they get caught up on this. So let's see if we can walk through this and help make sense of this. Okay, so cancer, that's future, right? Will you get cancer if you smoke cigarettes? Like maybe, but it's not guaranteed, and it certainly wouldn't be immediate. Sort of a lifetime of smoking, oftentimes is what it takes to get cancer from smoking. Same with death, same with emphysema, same with heart disease, right? It's not like you smoke one cigarette and you automatically are dead or have cancer or emphysema. So these are future consequences, okay? Yellow teeth, again, that wouldn't happen after one smoke. That would be the kind of thing after like prolonged smoking, right? Potentially yellow teeth. However, The relaxing part, that would be immediate, right? Like you get that immediately from having that smoke. Same with taste good. Standing in the cold, again, this is a negative one, but yeah, like it's immediate. Like that's happening, right? If you live somewhere where you have to like go outside and have smoke and it's like winter in, Wisconsin or Minnesota, like, yeah, it's cold, right? That's immediate. Breaks from work, that's immediate. If you're going outside to have smoke, you're obviously not, those are incompatible behaviors, right? So that's immediate, that break from work. And the satisfying piece of it too, right? Immediate. Okay. So the future immediate thing, sometimes students get hung up on a little bit. And I would say that actually more than anything else, the certain uncertain is where students really get hung up. So we'll walk through these and we're going to go through some more examples to help kind of unpack that. But, are you going to get cancer? You don't know that for sure, right? There are some people who smoke their whole lives and they wind up, dying of old age. Like they don't get lung cancer, they don't die of cancer. Especially, or similarly, I should say death. Like it's not guaranteed, right? Same kind of deal. Maybe you die of something related to smoking. Maybe you die of something completely unrelated to smoking. You just don't know. Will you get emphysema? We don't know. That's not guaranteed. Will you get heart disease from smoking? Not guaranteed. Will you get yellow teeth? Not guaranteed, right? So guaranteed, sort of certain, uncertain kind of thing. Like, is it a guarantee? Definitely going to happen? Or is there a chance it might not happen? The relaxing part though, right? Again, these are the more like immediate things. Like if you find having a cigarette relaxing, then like that's going to happen when you have that cigarette. That is not only immediate, but it's certain. If you really like the taste of cigarettes, not only is that immediate, but it is also going to be certain, like while you're literally smoking that cigarette. Standing in the cold, we could call that, it sort of depends where you live, right? I mean, for anybody, any generic person, we don't know, depending where you live, depending on the time of year, maybe not, but you sort of know that if you're having a smoke in the winter in Minnesota, like it's going to be cold. But if you're having a smoke in the summer in Minnesota, it's not going to be cold, right? So you can see how that actually, okay, maybe we call that uncertain, right? Breaks from work, uncertain. I don't know. I'm not totally clear on why that one gets an uncertain. I'm not sure there's too many jobs where you can smoke while you're on the job. Maybe there are some. Again, I suppose it depends on the job, but I would think that by and large, if you're going to take a smoke break, it involves a break from work, which I think would be positive. I think would be immediate. And I'm tempted to call that a certain. But, maybe we can think of some examples where that's potentially uncertain. And if it's satisfying, if you find a smoke satisfying, well, it's going to be positive. It's going to be immediate. It's going to be certain as you're having that smoke, right? So again, here's the example here. This is for smoking. This is not super relevant to what we're doing, in the world of ABA. But the important point here is that for this single B, how many different A's are there and how many different C's are there? And we're not talking about every single A is linked to a specific C. That's not quite how this works. But what I really find useful and important about this is for you to think about the fact that, and again, this term, I'm sure, competing contingencies. How many competing contingencies do we have here? We have a lot of negative consequences. We have a lot of positive consequences. Which ones are actually maintaining that behavior? Which of these contingencies, behavioral contingencies, is exerting the greatest effect, the greatest impact on whether this behavior continues or whether it, whether it increases, maintains or increases in future probability or whether it decreases in probability, right? It's a lot of contingencies here and they're not all working in the same direction. So this is the key that I want you to kind of wrap your head around. This is how I want you to think about the behavior of your coworkers, yourself, and as a future BCBA, think about the behavior of the RBTs and the aspiring BCBAs you have to supervise, okay? Because it is not just a simple 1A, 1B, 1C. It is not, okay? It is a very complex set of competing contingencies, and you need to be able to sort of analyze and understand them as such. All right, so that's the behavior of smoking. Now, again, this is from your textbook. It's the very next table in that particular chapter. But interestingly here, we have now the behavior of not smoking. And the important thing here is even though smoking and not smoking seem like just opposite sides of the same coin, right? Like if you're doing more of one, you're doing less of the other. Or if you're doing more of the one, you're doing less of the other. That's just not quite how it works. And we'll see that here as we examine the antecedents and consequences of not smoking. All right, so again, just to recap here, we're talking about not smoking, and they throw in here like chewing gum or some behavior incompatible with smoking. We think about incompatible behaviors and we talk about DRI, DRA, DRO, and absolutely, those are super, super important concepts within behavioral science. But it's also possible you could just refrain from smoking and not have to engage in like an overtly incompatible behavior, right? So that's thrown in here as sort of an example, but that's not necessary, right? If we just focus on not smoking, okay? Now, what are the antecedents and consequences of not smoking? And are they just simply the flip side of what we examined on the last slide? The short answer is no, it's not just the flip side of that. So what might be some antecedents for someone who, let's say, has historically been a smoker, and how do we get them into the camp of changing their behavior and not smoking? Okay. Well, some antecedents, and there's only 4 of them here. A friend dies of lung cancer. Okay, that could be an antecedent that could shift someone's behavior into quitting smoking. If you have a heart attack, that could be an antecedent event that could motivate you to quit smoking. If your family complains, absolutely, right? If your children complain, you're killing us. So there's only 4 here, and frankly, obviously, we could probably list out plenty more antecedents that could, and frankly, it's sort of a mix of antecedents and MOs, that could sort of shift our behavior in the direction of, I'm going to quit smoking. Now, what are some of the consequences associated with quitting smoking if you have been historically a smoker, a regular smoker, and you decide, man, I need to quit? What are some of those consequences? Well, you could be irritable. Is that positive or negative? Well, in terms of do you like it or not, is it pleasant or unpleasant, or repetitive or aversive? That's going to be unpleasant and aversive. It's going to be negative, and that's going to be immediate, and it's going to be certain, right? Like you're going to experience that, at least at first, right? That's probably going to wane over time, but you're going to experience that. Less of a chance of a heart attack. That's a good thing. That would be in the future. And is that definitely going to happen? You can't say it's definitely going to happen. All right, food tastes better. You do hear this, right? People say, oh yeah, like taste food better again, right? Smoking kind of dulls your taste for different, your sort of experience of food. Okay, well, that'd be a positive thing. It's not going to be immediate, right? It's going to take some time. And is that guaranteed to happen? No, it's not guaranteed to happen. Hopefully, it's not guaranteed though. Are you going to be craving a cigarette? Well, that's going to be negative. That's going to be immediate. And that is, at least at first, like craving a cigarette, like that's going to happen, right? Living longer, that of course would be positive. That'd be a very delayed future consequence. And is that guaranteed? You're going to live longer? Not at all. Reduce risk of cancer, obviously similar kind of thing. That would be positive. That'd be future. That'd be uncertain. Okay. So just to pause and recap here, we talked about smoking, and we had a whole list, which is an undesirable behavior, right? Whole list of antecedents, whole list of consequences, and we were able to look at those consequences and kind of list those out as positive, negative, immediate, future, certain, uncertain. Some are positive, some are negative. Some are immediate, some are future. Some are certain, some are uncertain. And then now we've done the same thing here with not smoking.